So what we presented in this meeting is actually preliminary data, but we're studying what we're calling the exposome of patients with Crohn's disease, and in particular very early onset Crohn's disease, which is kids that are diagnosed under the age of 6. And the premise here is that inflammatory bowel disease is thought to be multifactorial, with contributions from genetics, host immune system, microbiome, and the environment. And because the incidence of inflammatory bowel disease is rising, there's been a lot of interest recently in the environmental contributors to the disease. And so what we're doing is we've worked with Crystal Pollett at Yale, who is really spearheading this study with the Very Early Onset IBD Consortium. And what we're doing is we're having patients wear what's called a passive fresh air sampler. It's like a Fitbit-like device that can sample almost 6,000 chemical compounds from the air. And so what we're doing is we're recruiting patients with Crohn's disease and then controls. And we are having them wear these bracelets for 5 days. We're sampling their exposome, and then we're looking at differences in exposures in patients with Crohn's disease compared to controls, and we're doing a sub-analysis with very early onset Crohn's disease compared to age-matched controls. And so we're sampling things like fragrances, pesticides, smoke, pollution, furnishings, food additives, things along those lines, and we're looking for differences. And we're aiming to recruit 300 or more patients. We have a preliminary analysis of 50 or so, which has shown some differences in exposure profiles in Crohn's versus controls. And so we're really looking forward to finishing up recruitment so that we can have a more robust sample for our analysis. So nothing that we have right now is statistically significant because, like I said, it was a preliminary analysis with small numbers, but we are seeing in Crohn's patients some plastics and some fragrances that were more prevalent in their exposomes compared to those of the age-matched controls. And so that's definitely a signal that we'll be looking to see how it pans out once the numbers increase. I think that the first step here is to better understand what environmental risk factors for inflammatory bowel disease are. And I think my understanding is that many studies to date have really focused on a particular exposure or a particular environmental trigger, and this is more of a broad strokes assessment where literally hundreds or thousands of compounds can be analyzed at once. And so I think the initial step here is to understand big picture what some of the environmental triggers of inflammatory bowel disease are, and then certainly down the line therapeutics or preventative measures might target those specific exposures, but I think we're a couple steps away from that. I think it's too early to say concerning, but like I said, certain plastics and certain fragrances have generated some signal as something that might be of interest. I know that Dr. Pollett has applied this exact same technology in other diseases, asthma, ADHD, autism, and others, and I think that some of the findings might be a little bit further along in those diseases, but certainly it'll be interesting to see what pans out for Crohn's disease and if there's relevance to those compounds in other diseases, or if each disease has its own exposomic risk profile. I will say that we're still recruiting at 6 different sites, and so we're excited to engage with patients with recently diagnosed Crohn's disease, and we're hoping to get more patients to wear these bracelets so that we have more data to analyze and present at a future meeting.